Hope you're well. This is 𝘾𝘼𝙍𝙁, nutritionist based in Ngong, and my objective today is to say hi and to get to provide information on ArthroXtra. Yes, there is amazing product here that is very good for your bone and for making sure that the cartilage is maintained for a long time. The fluid inside the joint is also returned into place. And the good part of this is that the knee joint and the hip joint and every aspect of the bone is taken care of. The joint actually serves you better and gives you a chance also to enjoy your health, because the joint is really what carries you around. And secondly, you find that the joints, they connect the bones, and most of the time they aid in the movements that you have, except for the skull bone. This prevents the surface from rubbing and actually provide the support that you require to move from one place to the next. Now, the beauty of this, the predilection sites include your hands, which really helps with when you want to move or play keyboard, and then your knee joint for helping when you want to arise from where you're seated, and the hip, especially when you're seated and when you want to move and actually do a number of things, including digging. The spine is truly affected, especially for those people who sit for long. The neck also involved. So the good thing about ArthroXtra is that when the knee is inflamed and the pain is heavy, then it helps you, especially when the weather is changing and you're feeling the discomfort that arises from that. Secondly, also helps you to turn, especially when you have swollen or deformed joints. The flexibility may be affected. This could also be cold water use, and most of the people that go through this find it very aggravated experience. So the joints that I'm talking about include the shoulder joint, the elbow joint, hip joint, finger articulation, and also the ankle, because the ankle really plays a lot of role when you're moving, include the knee, the wrist, and then the vertebral articulation. This is key for helping you in your movement and for making you have that fluid movement from one place to the next. Then even worse, if you need people to move from to get upstairs, especially for when they have to climb stairs, and the pain in their joints really is a major issue. So now when it comes to the evolution of osteoarthritis, you find the cartilage turns thin, and this plays a major role, especially for movement. And then the thinning of the cartilage really affects because the cartilage now develops fragments and then develops bone spurs. And overgrowth of these bones appear the cartilage fragments. And this really is very painful. And that's why most people resort to having to take painkillers. So the leading cause of disability include arthritis, especially the rheumatoid arthritis. There could be spine problem and other problems that arise because of deficiency of calcium and all that. Other treatments include losing weight, aerobic exercise. But when you're going through this therapy, it is also important that you take painkillers. But I don't want people to take painkillers for a long time, because this also results into things like ulcers. And for some places, you find that in surgery, there is debridement and then joint replacements. So to save you from having high cost of medical surgeries and having to go through artificial joints, and these high-cost treatments really affect families who have to go through a number of fundraising to do all this. So some cases you find that a parent, or maybe if you had an accident, then you're sentenced to having painkiller drugs for a very long time. The drawbacks is that this may be harmful for the gastrointestinal health, especially when now one has to have ulcers from addressing the problem that they could have sorted from nutrition. Now, osteoarthritis comes into place and is a major threat to the bone and health and cartilage health, because this actually, the wear and tear is high, and for certain areas, you find that osteoarthritis, it reduces the movement quite considerably. And in a case where osteoarthritis is involved, then the degeneration of cartilage inside the joint is very serious. This also results into pain, joint pains, the tenderness of the joints. You also have stiffness when they have to move from one place to the next. And this causes a locking of the bones and sometimes a fusion. So when the bone surfaces become less protected by the cartilage, this exposes the bone to rubbing, and there are lots of friction that happen because of that. As a result, pain for the movement, the atrophy of the region of the muscles may be also engaged, and especially lax ligaments that really we use for moving from one place to the next. The worrying trend is that you find that mobility is affected in osteoarthritis, and especially when one gets to age 44, this increases rapidly. And looking at most of the surveys that have been conducted, you will find that the worrying data and facts that come because of poor joint care, you find 9.6 men and 18.0 women aged 60 plus have osteoarthritis. And if you look at the 4 billion people that are developing osteoarthritis, we find that the patients have limited movements and 25% cannot perform major daily activities. This really interferes with your productivity at the long run. And the solution that I give is called ArthroXtra, which really gives you the results that you're looking for in terms of giving the body the amino acids that it requires and helping the joint and the connective tissues to work properly. The important component of fluid inside the joint, actually, which will help the synthesis of the substance in the body, and actually helps when reducing aging, which really has it has glucosamine, which really most of the times erodes with time, and with proper daily food intake, this would really go a long way in making sure that the joint health is up to date. And we also give it glucosamine, which is a major product for the cartilage and helps so much when it comes to physical movement and making sure that it relieves you of pain. Then the enzymatic activities in the cartilage also helps with protecting the cartilage membrane against the friction that may happen. Now, chondroitin helps with increasing glucosamine concentration. And actually, the best part of it is that it maintains joint moisture and preventing that friction that happens because the bones are touching. Then the main water inside the joint will nourish and also helps with the absorption of other minerals in the body, which plays a major role in the application of this ArthroXtra for dual nourishment and strengthening of the cartilage around the joints and promoting joint flexibility and mobility. And once we give you this, it will relieve joint pain and regenerate that joint completely. I'm sending you this so that we can know where we can send you this. I'm based in Ngong, Nairobi, and the best part of this, I'm availing my number there, 0725971726, and we can send this to your office door or probably your home so that we can monitor and help you have a healthy joint from now moving forward. Just inbox me so that we can make the deliveries possible, and we wish you well as we help you regenerate your joint and have amazing joints moving forward. Thank you and have a good one.